At the beginning of the pandemic, nursing homes became epicenters of coronavirus cases across the country. You remember that. Now, 7 months in, Maryland Governor Larry Hogan is giving the green light to start allowing indoor visits again. What does this mean for centers in this area? Our Jess Arnold joins us with the answer. Hey, Jess.
Hey, Bruce. Yeah, at the peak of the pandemic, Bruce, COVID deaths in Maryland nursing homes accounted for more than half of the state's death. Sagepoint in La Plata and Larkin Chase Center in Bowie were two of the hardest hit in our area. So we asked them where they're at now and how they're prepping to let visitors back inside.
She survived the COVID, but the isolation is proving to do far more damage.
Jerron Levi's 76-year-old mom lives at Larkin Chase Center in Bowie, which per Maryland Department of Health data has had 80 resident COVID cases and 19 deaths. Her mom caught the virus but recovered. Since March, she's only seen her via Zoom and through her window.
I've seen definitely in the last month an escalation in her dementia. I associate it with just, the lack of things to do and movement and social activity.
Now that Governor Larry Hogan has said nursing homes can resume indoor visits, would she go?
Absolutely, immediately.
Besides Levi, we spoke with the president and CEO of Sagepoint Senior Living Services, Larkin Chase Center, the president and CEO of the Health Facilities Association of Maryland, and got info from the Maryland Department of Health and Centers for Medicare and Medicaid Services. What are some of the state's requirements for indoor visits? CMS says facilities must have no active COVID cases in the last 14 days and no testing in progress. Visitors will have to wear masks, sanitize, socially distance, and visits should be in designated areas. Larkin Chase says they're working to get ready by acquiring safety barriers, identifying areas where the visits can occur, determining how many visitors can be in a center, developing schedules, and acquiring additional protective equipment and cleaning supplies. As of May, Sagepoint Senior Living in La Plata reported nearly 100 cases and 34 resident deaths. President and CEO Andrea Dwyer said they've been offering outdoor visits since September. So are they ready to offer them inside? She says not yet.
We've actually hired a consultant to look at this airborne issue. The, HEPA or UV, those kinds of systems. We would maintain that same kind of physical setup inside as we did outside. So we would still have everybody masked, everybody sanitized, and then the plexiglass between with a minimum of at least, 3-4 feet on each side away from the plexiglass.
She and the Health Facilities Association of Maryland are concerned about the PPE supply chain.
So you're trying to balance residents' rights and dignity with all of these other clinical aspects and regulatory environment. As long as most family members are satisfied to continue to visit outside, that would be the preferred.
Now, the state is also offering rapid testing to these centers in an effort to help them prepare for those indoor tests. Sagepoint, however, is concerned about the efficacy of those rapid tests. We will dive into that as well as other testing options tomorrow on the Q&A. But if you have any questions, please just send them our way. Bruce.